Hey, thanks so much, Tim, and welcome everybody. Glen Pettersen here from athenaHealth. Just a quick introduction, Tim. I've been with Athena for
Yeah.
about ten years now, and spent the first 5 years on the Athena practice platform or Centricity, and then quickly moved over into athenaOne. I've been in the healthcare space for about 25 years now. Hard to believe it's been that long, and I live in Tampa, Florida, with my wife and three beautiful little girls, ages 9, well, actually 10 now, 14 and 17, all three little volleyballers. I'm also a United States Marine Corps veteran. So I think you're going to be staying on with me here, Tim. We're going to be
Yes.
doing a little role playing, correct?
Yes, Nikki, if you can bring me back up for a
Okay,
second. There we go. Awesome.
great. And I'm
Yes,
going
I
to go
get to
ahead
be
and
the patient today as well. This is
yeah,
great.
and we're just going to take a minute and just demo our ambient solution, and I think that will kind of really demonstrate some of the work that Athena is doing. So I am on my athenaOne mobile app, and I just opened this. This is an app that kind of goes right to my schedule for the day, and you can see that I have it filtered down for my schedule of patients, and on each patient there is a start ambient button. So I'm going to go ahead and press the one for Tim is playing the role of Jason today. So let's go ahead and start the ambient. It does ask for consent. Tim, we're going to be I'm going to be using an AI note taker to kind of better do some documentation today. Is that okay with you?
That is perfectly fine. Thank you.
Okay, thanks. Great. Well, let's get started here. So, really great to see you again, Jason. I'm Dr. Medina, and how can we help you today?
Well, I've been having increased back pain after a recent injury when I slipped on a wet floor, and now I'm experiencing some numbness and some pain shooting down my right leg.
I see. I know you've been in the clinic here before with some back pain. Is this similar?
Yeah, but it's much worse than my usual back pain, and the leg pain is really sharp.
Oh, wow. Have you had any loss of bowel or bladder control? And what makes the pain worse? Have you tried anything at home?
I haven't no problems with using the bathroom. I did try some Norco and gabapentin I had left over at home. It really only helped a little, and changing positions makes it so much worse.
All right. Well, let's examine you then. Okay. Upon examining you, I found some tenderness in the lower back muscles and some limited range of motion. Your straight leg raise test, it was positive on the right, which supports nerve irritation. There's also some decreased sensation and slight weakness in your right leg. This fits with sciatica due to possible nerve compression.
So what does all that mean, and what can we do?
Yeah, great question, Jason. Well, let's go ahead and get an MRI scan of your lumbar spine to see if there's a herniated disc or other tissues compressing the nerve. Meanwhile, I'll prescribe you some naproxen 500 milligrams twice daily for a week, taken with food to reduce the pain and swelling. Also, muscle relaxant, cyclobenzaprine 5 milligrams at bedtime for 5 days for muscle spasms.
It sounds like a lot of stuff. What should I be watching for with these meds, and what if they don't help?
Yeah. Well, take the naproxen with food to protect your stomach, and be aware that it can affect your blood pressure. The cyclobenzaprine may cause drowsiness. So avoid driving until you know how it affects you. If nerve pain continues, we could add in that gabapentin to help.
All right, what if things don't get any better?
Well, if your symptoms don't get any better, then we can do an epidural injection to targeted relief. It's done under image guidance, and we inject steroids near the irritated nerves to decrease inflammation.
Geez, what does that involve?
Yeah, it's a common question. This procedure uses X-ray guidance to place a needle into the epidural space near the affected nerve. You'll be awake but numbed locally. The injection usually takes about 15 to 30 minutes, followed by observation.
Okay, is it safe?
Yes, it's generally very safe and carries small risks like infection or bleeding, but we monitor carefully and provide instructions after the procedure.
Well, in the meantime, what else should I be doing?
Yeah, so let's limit heavy lifting, twisting, and prolonged sittings. You can use heat and cold at home as needed. Once your back is better controlled, we'll send you out to physical therapy for exercises to strengthen the back and core.
All right, and then when should I be coming back to see you?
Yeah, let's plan for a follow-up in 1 week to review our MRI and progress. Contact us sooner if your symptoms worsen, especially if the leg weakness or bladder issues continue.
All right, thanks, Doc.
No problem. Thank you very much. And I can go ahead and pause this and go ahead and move out of the exam room and then go ahead and dictate my exam. So I'm going to go ahead and resume this, being out of the room. Back examination reveals no visible deformities, swelling, or skin changes over lumbar area, tenderness over right lumbar paraspinal muscles and sacroiliac joint region, lumbar flexion and extension reduced secondary to pain, limited lateral bending on the right. Straight leg raise test was positive at 40 degrees, provoking radiating pain down the right leg on the right side. Faber test was negative bilaterally. Decreased sensation to light touch over right L5 dermatome. Slight weakness to right ankle dorsiflexion, grade 4 out of 5. Plantar reflexes symmetrical 2+. Ankle reflexes diminished on the right side. Mild antalgic gait favoring right side noted. Now, all I do is I can go ahead and preview this for summary at this particular point, or I can go ahead and send this to the chart. This usually takes about 90 seconds in my demo environment. That's just because it has to go across a couple of different firewalls, but generally about 30 seconds within a live environment. And that will put all of the information into its prospective places. As you'll see in a minute, the HPI goes into the HPI section, the physical exam goes into the physical exam section, and those different sections will be placed in the proper area. So here it is, it's adding to the chart. It's been successful. And now we can look at what we produced with that. So there's my HPI that's been put in there based on the conversation that Tim and I had. My review of systems came in there, as well as my physical exam that I dictated after the patient left the room. And I can go ahead and make some other notes in here. In the athenaOne app, I have lots of different functionality, but I really wanted to spend most of our time today over in athenaOne. So let's go ahead and we'll move into, I'm going to go ahead and take down this reflector app here, and we'll go ahead and jump into athenaOne. There's some things that I wanted to review today. I want to thank Kaylee, Megan, and Ken for that great discussion. It really stimulated some of my thought, and I wanted to jump into some of maybe even these pre-visit workflows. I pulled just generated really quickly a care gap work list based on, and these are really some nursing workflows. I could be a care coordinator or nursing quality manager. I want to see what the patients that are coming in the upcoming days for a particular provider are due for, and it gives me the ability to jump right in there and go ahead and prep the patient's chart. As you'll see in just a minute, I can prep patients' charts before patients arrive at the clinic. I document in there, it puts a little blue indicator letting me know that the work has been done with the chart before the patient has been checked into the clinic. I can do that. I can generate it for any period over time, and just really helps me to close those different gaps of care. The other thing that I'd like to call out here, as far as something that was called out during the previous discussion, was kind of that group call campaign. As a quality manager, I can certainly start to filter down, and I'll say, I want to look for all of our patients that are due for influenza vaccine coming up for Dr. Medina. And when I run this report, athenaOne will quickly generate all of the outstanding patients that have not satisfied that, and then I can send out that group call campaign. Athena will alert those patients that they're due for some kind of test, and let's go ahead and contact the clinic. Let's move over. The last thing I wanted to show before we move into athenaOne, into the charting portion of the demo here, was the reporting library. And this was something that was called out heavily by Kaylee and Megan. And the Athena has hundreds of pre-built reports in our best practice reporting library. They are broken out into the different sections, from whether they're clinicals reports or even something as simple as a front desk time of service collections report. I heard that during the discussion today. I can run reports at any time within Athena, but I can also schedule reports to be ran on any daily, weekly, or monthly cadence. I can also set that up to be sent out automatically to different recipients. And those are other users within our practice. And that's what will send out those reports and generate them automatically to your inbox. There is the report builder, which I did hear earlier, and this is, you don't have to be an HTML coder or a Crystal report writer to write reports in athenaOne. You simply select the type of report that you would like to generate, select the display columns, the filters. You can preview and schedule the report as well as view those results. But as far as automation and efficiency goes, let's jump over into athenaOne. And I've jumped over here to the home-based work page. We are a truly cloud-based solution, so there are never any servers in the back closet that need to be upgraded or maintained. Just real-time access, essentially whenever and wherever you need it. All you need is a computer, internet, or the athenaOne mobile application on your mobile device. But I logged into the clinical version of the home-based work page. And in the middle of the screen, I can see the schedule today, which is a little bit more of a tracking board for Dr. Medina. The other thing that I did hear earlier that I should call out is Athena is really great on tasking. And on the left-hand side, you'll see the provider's task list. And I am logged in as Dr. Medina today. And this is an exception-based workflow. So the items in this work list directly need my intervention as either routing along to another staff member or provider. Also, could be just signing off that into the chart or acknowledging that I've reviewed it. One of the things I'd like to call out, the Athena is a permission role-based system, and this is something that we always wanted in Athena practice, is that every user gets an individual username, every provider gets an individual staff inbox. So if you have multiple nurses or staff members that work under provider, they can log into, with the proper permission, into just a single staff inbox. So we send tasks to a single role rather than an individual person, because if that person's out, obviously the work wouldn't get accomplished. And then we set up the practice roles, right? So medical records, referral coordinator, surgical coordinator, and then we can send tasks to those individual roles. That is something unique to athenaOne. I figured I would call that out. And then as a provider, I know these are the tasks that need to be completed during the day. I do see an urgent task at the top of the list from the staff. Patient is called in today and they're having some increased UTI symptoms. They want to know what they should do. Let's go ahead, and I'm just going to send a message back over to the sender and put in a dot phrase. I'd like the patient to come in for a call, to come in for an appointment today. Let's go ahead and save that, and it moves off of my task list and routes over to my staff. They can call the patient in, and also drops off this task list. Right from this list here, I can see how many of the patients are in the office getting ready to be seen. Encounters are unsigned notes. So as was mentioned earlier, those tasks are automatically routing into the proper inboxes depending on my role within the practice. Patient cases or portal messages or phone notes. Sometimes we don't like direct portal messages to go directly to the provider. Let's reroute those to a triage nurse or a staff member through something called a task assignment override. That's where we reroute those documents against what the best practice rules. So we don't want the provider to be kind of bogged down with too many patient cases. We'll send those over to some staff members to get handled. Now, orders, RX, and auth filter into this area. I can see prescription refills that come in from the pharmacy. There's some authorization management. The one thing I'd like to call out that's unique about athenaOne is that we have closed loop order management. Now, no orders are queued up in this section. They're queued up in the patient's chart, which you'll see in a second. But I can quickly queue up, and when I queue up an order, lab, imaging, or referral, there is a default alarm in there. That means Athena is expecting to receive those results back. If we do not receive them back within the allotted time frame, they will drop into the needs follow-up bucket down here at the bottom for the staff. So we do see all of your orders completely through the closed loop ordering process. And when labs and imaging come back into Athena, they come into this labs and imaging work list. I can see what's critical, what's abnormal. It gives me the ability to jump into any of these labs, review the results. I can track and trend analytes and even graph them against medication management. So that's a little bit about some of the inbox information here that I can review. But remember, we have some patients that are waiting to be seen. And Jake Medlock's waiting to be seen. He's here for some diabetes, some hypertension, and some hyperlipidemia. There is a briefing page where I get a one-stop shop of everything that's going on with the patient in a 360-degree view. The left-hand side is some historical information. I do see there's some tracking and trending of their vital signs, as well as this patient has a diagnosis gap, that there's some other diagnoses coming in from the payer when this patient saw other providers, and we can go ahead and add those. So I do have the ability to add those from the chart right here. I also can see my note from the last time I saw the patient, as well as the recent activity, where Athena collates in a time-based sequence all of the interactions with the chart. As I move into the exam, I'll close the problems area, and this is where I can review what the staff put in during the intake stage and quickly move through my different sections. There's the ability, expediters, to move information forward from previous visits, or turn on the athenaOne voice to dictation app. Information flows forward that's been documented by the staff, called out in red, as well as I can pull forward information from previous visits. I do see this patient indicates that they want some skin tags removed from their neck today, so let's go ahead and get those removed. And these are mapped into the super bill. So when myself or the staff documents in this section, there's no chance that somebody forgets to add it to the super bill. In the assessment and plan section, the patient does indicate and lets me know they need a refill of their lisinopril. So let's go ahead, and we do have one-touch refills by just hitting the blue arrow from the patient's med list. That is now refilled, but through some of that automation and machine learning and AI, Athena is tracking my my prescribing and ordering behavior. So let's go ahead and also prescribe this patient a statin for their hyperlipidemia. I'll quickly add the quantity in there, but we do have Hippocrates embedded right into the workflow, as well as the pharmacy is brought in from the patient intake section, as well as interaction checking, and it lets me know that this is covered on the on this patient's formulary. And then I'm pretty much done. I can sign off my orders for today and be done with the note. And that's as easy as it is to document the visit. So I know we're a little bit coming up on time. I did want to take a pause, Tim, and not go over. This was meant to be just a highlight to really get everybody's interest to go ahead and schedule a demo for today, so we can get into some of those workflows. So
yeah, we still have a few. Yeah, I'm sorry. I was going to say, we still have a few folks on. And so if there's a couple more things you want to show, I'd say take another 5 minutes for sure.
Sure.
If you think you can, yeah.
Yeah, thank you.
Okay, cool.
The other thing that I'd like to show is in the assessment and plan section, we do have return to office orders. So this is where Athena actually tracks compliance of patient care for you. So let's say I want this patient to come back in 3 months for a follow-up visit. Let's go ahead. This is immediately available at the checkout desk, so there's no confusion when they would like the patient to come back for a follow-up visit. It also creates an appointment tickler, because if you asked me to go ahead and schedule an appointment today at checkout, I would say, well, I travel for Athena. I don't know if I'll be in town. Can you just call me when the time gets closer? You know that sometimes translates to a missed opportunity. Well, Athena tracks that and actually surfaces in a work list for the staff. The last section is the sign-off, where athenaOne briefly summarizes what I documented today. And because there were some other providers within this patient's care team, we queued up some consult letters that will automatically be sent out. This is just a brief consult that be sent over to some other providers in this patient's care team. They were queued up automatically, which really leads us into the last section, which is the integrated billing slip. And I know that Megan and Kaylee talked about provider efficiency, but everything is mapped over, right? So the appointment summary details come over from check-in. The diagnosis is flow over from the assessment and plan. And down below, the only thing that really needs to be put in by the provider is if they did some level of E&M on the patient today, 99213-214. There is an embedded third-party E&M coder that will give some coding advice based on the 2021 guidelines, so amount of time spent with the patient or complexity of the decision-making. Everything else is mapped in the background. So we ensure that everything is captured within Athena. So that's about it of the things that I was planning on going over today, Tim. I don't know if there's any questions. If not, we'll turn it back to you.